Hi, welcome to week 3 of the book club. This week we're going to be discussing chapters 3, 4, and 5. We'll just do a real quick recap first, Ben.
Yeah, so I guess this part really gets to the heart of the book, Boychuk's book, which is talking about, this is the section that the 3 chapters that go sort of race through the United States history of health policy and health reform in the U.S., at least since, World War II era up through the Clinton reform of the 1990s. So really briefly, the argument he's making, which is really compelling and interesting compared to all the other narratives out there about how health reform did and didn't happen in the U.S., he argues that, during the immediate post-war period, there were some real significant attempts by U.S. presidents to win national health insurance, but they failed mostly because they were intimately tied with pushes for civil rights and for desegregation in the South, and that they were never able to overcome the sort of opposition from congressional Dixiecrats in the South who were committed to defending segregation. And then he says, basically the Democratic leadership gave up that strategy at that point, and in the 60s shifted towards trying to pass Medicare, which was just sort of universal health care for seniors. And they were successful only because of a few interesting developments. One is that desegregation of education was already happening, had already won in the courts, and it looked like it was about to happen in hospitals anyway. There had been a bunch of court rulings against segregation, and then the Civil Rights Act also passed in 1964, which was one of the most important things because that also further guaranteed that probably medical services were going to be desegregated. So Medicare was then able to pass, but the Medicare package, I've always wondered why Medicare has all these holes in it, all these gaps, and it turns out that a lot of them had to do with accommodating segregation in the South. So that's why there's a premium for physician services for Part B in Medicare. It was so that segregation could continue under physicians. And similarly for nursing home care, that's why a lot of nursing home care got stuck into Medicaid. And that's also why Medicaid was controlled by the states. It was so that only hospitals had to be desegregated and nothing else. And those were, Boychuk says, those were sort of the political conditions that allowed Medicare finally pass when all these other truly national health insurance plans had not been able to pass. And then he sort of races through 30 years of history very quickly. He very briefly touches on sort of the era of like the Nixon and Kennedy healthcare proposals, not much there. And he digs a little bit into the Clinton era reform, where he says race played less of a role, but sort of a role. And I think his argument is a little weaker, a little harder to follow, for me at least, than the really strong history of the 40s through the 60s. Does that sound about... That cover all the big stuff? All right. So what sort of leapt off the page for you in terms of implications for interesting things you didn't know about the history of it and implications for today? And
Sure. Well, to continue what we talked about last week about at least my preconception going in, why didn't we have a national health insurance plan and Canada did? And he talks about the different, or the role of doctor's choice, the argument that played, or the role that argument played in getting Canada to have health insurance and versus the U.S. And I thought what was interesting about that was that in Canada, it was what it meant for the right to choose was just simply that doctors had the right to be compensated on their terms. Whereas in the U.S., it meant something much broader. It had a lot more baggage. It also meant, or it also implied, like whites' rights to live in segregated areas if they wanted, and things like that. And it didn't just mean doctors' compensation or a doctor's right to choose like how much they were going to get paid, but also doctors' right to choose what patients they wanted to see, what kind of physicians they wanted to work with. And I thought that was. That was really bolstering his argument about the idea that like the U.S. wasn't necessarily any more individualistic at this time than Canada. So
yeah, it was amazing to me how the language attacking national health insurance back then in the 60s was basically the same as what we see today, but it actually had a meaning then, and the meaning was we need to protect segregation in the South and in the North as well in a lot of hospitals. You mentioned the sort of the language of choice, which we still hear today, and it doesn't make sense today because you get more choice under a single-payer healthcare system.
Exactly.
But back then, the right to choose was sort of the universal language to oppose civil rights. It was the right for white people to choose not to treat black patients. It was the right for white patients not to have to use the same, all this sort of fake rights language and fake choice language. We still hear that today, but it doesn't have the same resonance and the same meaning. So I think that's the origins of a lot of the language that we hear opposing single-payer healthcare today. And I was struck by also just the origins of the attack on socialized medicine, characterizing national health insurance as actually a government takeover of the provider system. And he said, Boychuk says that didn't happen in Canada. That language wasn't used to oppose national health insurance, even though there was significant fight back and opposition to national health insurance in Canada. And here, the reason that it had so much meaning is because actual socialized medicine would mean desegregation of the entire healthcare system in the South. If there actually was publicly run hospitals and nursing homes and physicians' practices and all that. Mm-hmm. And that's why the attack on socialized medicine was so powerful coming from the American Medical Association. And that's why it resonated with the congressional sort of delegation from the South. So what else do we have here? We can talk a little bit about the Clinton era, which I think was a little less clear-cut. We can talk a little bit about the lead-up to the Clinton era. What do you want to dive in on? This is where we get murkier, I think, in terms of the role of race and the politics of race.
Are we talking about before the Clinton era?
Yeah, let's talk a little bit. Let's really quickly talk about that. So, is that passing it off to me?
I'll let you go first.
All right. There's not even a separate chapter for this. It's just sort of mentioned in passing from one chapter to the next. He says a couple things. He says that one thing is that in order to buy off opposition from physicians and hospitals to pass Medicare and Medicaid, there was basically no cost controls initially. Physicians could almost set their own prices. And one thing he says was that ended up making it harder to pass national health insurance for the next 20 to 30 years. Because it became such a financially unsustainable program for a while that it was hard to argue for expanding Medicare to everyone, which is the language we use today, Medicare for all.
And that also allowed private interests to come in and do Medigap sorts of measures, and which further deflated the possibility that we could expand public insurance. Right.
So part of the it recurs throughout his narrative is that there's these things that happen that delay the possibility of passing national health insurance, and then you end up in a different political setting. So I think he's making that argument. I'm not sure if I fully buy it, but I think it's very interesting. It's definitely true. Not until sort of the 80s, really, did they implement cost controls for Medicare and Medicaid. So that, more or less brings us to the era of the Clinton health reform attempt, which was not successful. Interesting that we're doing this during a Hillary Clinton election campaign when a lot of this history is being dredged up, actually. But Boychuk says during this period, he actually says that the politics of race didn't play a very direct role in defeating the Clinton proposal, and that it was happening at the same time that welfare reform was happening, which is all about race, and it was the same time where sort of clamping down on crime and the war on drugs and all this stuff was taking place, and that was all about race politics. He says the Clinton health reform effort not as much, but he says indirectly a lot of the anti-government and anti-tax sentiment that was sort of welling up during this period in the 90s, and he doesn't talk about it, but that's also the period where the tax revolts were happening in lots of states. These ballot initiatives sort of banning all sorts of taxes. That a lot of this had to do with racism. It had to do essentially with perceptions of who the government supports, who government subsidies go to, where their taxes are used. And it was a revolt by middle-class white people against what they perceive as people of color being the recipients of all these programs. So he says indirectly that sort of political atmosphere of racism impacted the possibilities of passing even the Clinton reform, which was not a national health insurance program, strictly speaking. So what did you think about the narrative? I know I had some of my own thoughts about that story of what happened during the Clinton era, but...
Yeah. Well, I think, of course, that race must have played a role. He even himself talks about how they were on the one hand contributing to the racial charging of the political sphere by doing welfare reform and then the crime bill, which has become very controversial recently. But on the other hand, trying to downplay the role of race somehow in health insurance, which I'm not sure if I totally understood that or bought the narrative. But then, of course, also he left out entirely the for-profit industry that has emerged since Truman first started trying to pass national health insurance. And I thought it was interesting that he mentioned in the book that in 1945, Truman was the first president who expressed explicit support for a program of national health insurance. And this was at a time when he also mentions that 50% of the population in the U.S. Wouldn't want a black nurse. And now we have a totally integrated system, and that's hopefully not a problem anymore in most places, and that we have a very high level of support for national health insurance. Recent poll, what was it,
58%.
58% would repeal the ACA and replace it with single payer. And yet we haven't had explicit presidential support for single payer for the last at least couple of cycles. So I think that really shows like the power of the for-profit industry in this discussion.
Yeah, and I thought it was the book sort of shifts to a different type of history when it's looking at the Clinton era. Back in the civil rights, we were talking about grassroots organizations, NAACP. We were talking about industry, like the American Medical Association. There was a little bit of that bottom-up history happening. When we look at the Clinton reform, it's mostly like public opinion polls. But we knew that, like you said, during this period, a large, powerful healthcare industry has emerged. Also, I think a powerful social movement has started to emerge in the 90s. I think it was just the beginning of the single-payer movement where we have actual single-payer groups on the ground. But definitely the labor movement was playing a major role in the Clinton reform, and even trying to push Clinton in the direction of single payer, and as opposed to the reform effort that was tried. So I think there was more there going on. And the other thing that we're going to, I think towards the end of this book, we want to talk about, what does it look like today for the present struggle for single payer healthcare? What are the implications of this? And also, what role does the politics of race play today? And I think the book, in looking at this period of the 90s, just doesn't talk about how especially political parties are still highly formed around the politics of race, and just how deeply ingrained the politics of race is in everyday politics. I think the downplaying of it in the Clinton reform doesn't quite do service to just how the whole political system is structured around the politics of race. Even if it's not explicitly, and I think there's more stigma against talking about race in public now, even than there was then, so it becomes harder to maybe chronicle it as a historian, but we know it's playing a role there. So any closing thoughts or? Nope.
No.
All right, well, let's wrap this one up, because next week we're moving on to Canada. I think we get 4 chapters of Canadian health reform history.
Bring it on.
Yes, let's do it.